Hello, I'm Janet Morena, the Executive Director of Priests for Life, and welcome to our program. Well, today we're going to be talking about a topic that I think is really important. We're going to go back into our archives to the shows that Father Pavone and I produced for Sky Angel called Gospel of Life. And one of the experts we interviewed was Dr. Philip Ney. And today's discussion in particular is going to be discussing why abortion isn't medicine. Now, see, Dr. Ney is a psychiatrist, but what you may not realize is he also went to medical school, because in order to become a psychiatrist, not a psychologist, but a psychiatrist, they go to medical school. So he learns all about kind of practicing regular medicine, and then he specializes in psychiatry. So he's got a lot to say about why is abortion not medicine? Okay, and that's really interesting. And then we continue to talk to Dr. Ney about another topic that I know, because of my work with the Silent No More Awareness campaign, is a very important topic. And that's for those people who've had an abortion. How do you tell your children that you end up having in the future, after you've had that abortion? Many of these women, had that abortion when they were in high school or college. Many of these people, they were forced to have the abortion, or they weren't choosing it, and come to regret it and go through healing. But then your born children, later on, you get married, you meet Mr. Right and have kids, and now how do you deal with this with your living children? Well, Dr. Ney has some very, very good advice as to why you really need to talk to them about this and how to approach it and how to do it. So I know you're really going to enjoy this show. So let's take a look right now at the show and interviews we did with Dr. Philip Ney.
It's America's most common surgery, but find out why it doesn't even qualify as medicine. Next on Gospel of Life. Hello, I'm Father Frank Pavone, Director of Gospel of Life Ministries. Welcome to our program. I'm with Janet Morena, our Associate Director. And today we're going to hear again from the man who, in our opinion, has done more research on abortion than anyone in the world. His name is Dr. Philip Ney. Now, Janet, of course, as you know, Dr. Ney is not only a great friend, but he really is a top-notch medical professional. He's a psychiatrist and a psychologist. He has taught as a full professor in about 5 different universities in various continents, done medical research, been a reviewer of medical journals, and in the area, of course, is abortion healing, and the various very innovative areas of abortion research, some of which he's going to talk about today in the clips that we will show.
And the important thing is to realize that Dr. Ney really discovered the connection with abortion and the damage by his work in child psychiatry for over 40 years. It wasn't like he started out to say, I'm going to deal with post-abortion. It was through the practice of psychiatry and the patients coming to him that he made that connection.
Exactly.
By asking the mothers, tell me about your pregnancies.
And he takes a very medical approach to abortion, and that's one of the things, of course, that he always talks to us about, is that, you look at this from a medical angle and you see, number one, why abortion should never happen, and number two, how you have to cure the wounds from it.
That's right. Abortion is the only surgical procedure where there is not a benefit occurring to the patient. Basically, you go in as a physician, you perform a surgery, well, you're healing something. This is the only medical practice, surgical procedure where a child is being killed, but there's really no medical benefit being obtained.
Well, not only that, but through your work with the women who've had abortions that exactly the opposite is true. There is harm that comes from this so-called health procedure.
Yeah, we have women from the Silent No More Awareness campaign through their testimonies, and people can read them on our website. These women were left, some of them sterile after their abortion. They had severe complications. We had one woman even had her colon affected, and bladder and other things. So, this is not a good medicine, let's put it that way.
Well, that's what Dr. Ney is going to talk about in this first clip. And as I always say to people, what disease does abortion cure?
Yeah.
There is none.
None.
Let's listen now to Dr. Philip Ney on this question of whether abortion is legitimate medicine. This is a very important theme here because you speak about evidence-based medicine. If you're going to introduce a medical procedure, either by legalizing it if it wasn't legal before, or simply by doing it, whether it's legal or not, if you're going to do a medical procedure, you've got to have some evidence that there's a medical benefit.
That's right.
And what we're saying here is, yes, there's a lot of evidence that abortion harms this woman, not to mention the baby and many others. But then you flip the question and say, well, what disease does abortion cure? What benefit does it introduce to anyone? And the answer to that really is nothing.
None. There's no studies. And I reviewed these because I've had to. I mean, Brenda Major did a study in which she purported to show the benefit. That is, people felt better immediately after having an abortion. When were they tested? Immediately before they had an abortion. What does that prove? Absolutely nothing. And that's the shaky kind of evidence on which people are saying there is benefit. There is no benefit. And my friend David Ferguson at the University of Otago in Christchurch recently published something, and poor old David really got his lumps because he showed in his child development study there's a lot of depression following. Now, it's interesting. People don't know that actually that was something that began with me because David and I did a study together like that many years ago. In any case, it's absolutely true. It's not the practice of medicine. Not only it doesn't have discernible, measurable, provable benefit, there's no necessity. And the first thing in medicine is necessity. What in the heck are you doing this for? And then you've got to show beyond reasonable doubt benefit. And then you've got to show beyond reasonable doubt that there are relatively few side effects. And then you've got to show beyond reasonable doubt that the person was informed. And then you've got to show beyond reasonable doubt that there were options given and the person had an opportunity to try those options. And then you've got to show beyond reasonable doubt you're competent to do this. And part of demonstrating that competence is to review your own practice and show from your own practice that it's beneficial. All of these things are totally ignored in almost any medical sphere I know. And doctors are blind to this. And they think, I'm wrong because I'm demanding something they would demand in any other medical procedure? No, of course not. And they're embarrassed by this particular inconsistency. But it's there, and the courts are not stupid. They know it's there. And it's time that people began saying, come on, this is a grave inconsistency. Is this a practice of medicine or is it not? If it's not the practice of medicine, call it something else, but don't call it this is medical practice.
I often make the comparison that a medical procedure helps the body to do something it's supposed to do, but is having trouble doing. Abortion does just the opposite. The body's doing everything it's supposed to do. It's doing it well. It's nurturing that child, and abortion's coming in and stopping all of that.
That's right.
It's the opposite of a medical procedure.
Right.
And in Roe versus Wade, as you know, in 1973, the U.S. Supreme Court said that the abortion decision is inherently a medical decision.
That's right.
Ultimate responsibility for it rests with the physician. So it didn't give the woman some kind of absolute right to end this pregnancy. I've often said if the abortion industry would only follow Roe v. Wade, we'd be in a much better position than we are today. Because if we demand that people look at it within the parameters of medicine, they have to come to the conclusion that you're saying here, that we've got to throw it out altogether.
That's right. Not only that, looking at Roe v. Wade, but looking at all the constraints placed upon medicine by medical colleges. If they would only apply those with respect to abortion, abortion would never occur because there is no necessity, there's no particular benefit, et cetera, et cetera. You can't practice anything apart from abortion in that manner. So why has medicine as a whole profession becomes so blinded to this is a curiosity that I hardly can understand. And as you know, Nathanson and Everett Koop wrote the book, Eclipse of Reason. I think it's more than an eclipse. An eclipse is a brief darkness. Mm-hmm. This is not a brief darkness. This is total darkness over a long period of time.
Mm-hmm. It's an immersion in the darkness.
It's an immersion of darkness.
Yeah, it really is.
And people are so immersed they don't even know they're dark anymore.
Well, we're grateful to Dr. Ney, and we're grateful to you, brothers and sisters, for what you can do to spread the word about what we've just heard him discuss. We'll be back with more from Dr. Ney after this break.
There's nothing wrong with your television set. You don't see anything because there's nothing there. Abortion, the most common surgery in America. Why don't we ever see what it looks like? A message from Priests for Life.
Happy birthday to you.
The decision to have an abortion not only affects that moment in your life,
Kristen Gordon.
it affects many precious moments to come.
I now pronounce you man and wife.
Please remember, where there's life, there's hope. A message from Priests for Life.
Welcome back, friends. We're talking today about Dr. Philip Ney and showing you some clips of a recent interview we did with him right here in the studios of Life Dynamics. And Janet, the next clip that Dr. Ney is going to speak to us in has to do with the question that many who have had abortions raise. And that is, I have other children. Should I tell them about the abortion I had? And this is a question that causes quite a bit of anxiety on the part of many parents, because on the one hand they feel that maybe they should tell them, and on the other hand it's a very difficult thing to do.
Well, you know, it's a question that we always have to deal with the Silent No More Awareness campaign, because when a woman comes to us and says, well, I've gone through healing and I'm ready to give my testimony and I want to stand there with that sign, I regret my abortion, the first thing we have to say to her is, do you have other members of your family, and do they know about your abortion?
Because if they don't know, we don't want them
We don't want
seeing it
right.
on TV.
Exactly. You know, so this is an issue. And then their next question is, well, how do I tell them?
Right.
And we rely so much on Dr. Ney's information about this approach.
Well, he is a child psychiatrist, and he has written on this topic, and he's dealt with a lot of families regarding it. So we're going to see what his opinion is in this clip, which we'll show in just a moment.
But then also, too, in this clip, he mentions fibromyalgia and the connection with abortion. And believe it or not, Father, you know, as we go through the testimonies with a lot of the women and then talk about how are you feeling in your health, this question of fibromyalgia keeps coming up. We have women in the campaign that have difficulties with fibromyalgia.
So, friends, is there a connection between that and abortion? Let's hear Dr. Philip Ney talk about that, and also about this issue of whether someone who's had an abortion should tell her children. Here's Dr. Ney.
Well, you can imagine, of all the secrets in the family, or I believe pseudo-secrets, abortion is the worst kind of secret. And parents try so hard to keep it away from children because they think it's really going to harm children. And then I show them, on the basis of some evidence, some good evidence, that there aren't any real secrets in the family. There are lots of pseudo-secrets. So when you're actually talking to your children about your abortion, most times the child will respond with, I know, and I'm not surprised, and all sorts of things like this. So even though a final admission, yes, I aborted one of your siblings, usually emits an eruption of anger on the part of the child, most of the children are not really unfamiliar with this fact. In fact, most of them are relieved. Now I understand why I have all these conflicts, why I have existential guilt, sense of impending doom, etc., etc. So it's a little bit like a brain tumor. You have a headache and you're thinking, oh, I wonder what's causing my headache. Is it possibly a brain tumor? And eventually the doctor says, yes, you have a brain tumor. Good news and bad news? Well, it's good in the sense now you know what you're dealing with. Bad news, who wants a brain tumor? And it's the same with these young people. You tell your children, yes, there has been an abortion, very bad news, but it's also a relief. Now I know what I'm dealing with. And over a period of time and lots of conversations, the parents and the children work this through, and the net effect is beautiful because now we have an honest conversation, we have honest communication, and the child concludes, if my mother can talk about her abortion with me, then I must be able to talk to her about anything that transpires in my life, including having sex with my boyfriend or whatever it is.
Right.
And if God can forgive my mother for having an abortion, then certainly he's going to be able to forgive me for anything I do. So there are some very, very useful things that comes from this. Hard, it's hard. And it has to be done gradually over a period of time on a need-to-know basis. And it's never a secret. Like adoption. It's never a secret. This should never be a secret. So parents need to talk to their children about their abortion. It has to be done when they've dealt with it themselves, and it has to do over a period of time on a need-to-know basis.
Dr. Ney, I'd like to ask you a question about insights and that you've obtained and research that you've done into fibromyalgia and some of its possible causes and relationships to other issues.
Well, in Canada, at least, fibromyalgia is a very common disease now. But still, there's a great debate about what is this thing? Because if you examine the joint, you don't see the usual indications of inflammation, heat and redness, etc., etc. But the patient says it's horribly painful. And I was looking the other day at an outline of where are the major points of fibromyalgia. They are the major joints, the shoulders and the hips, etc. And I thought, well, that's kind of interesting. Why those joints? And about 2 years ago, a patient came to me complaining of the fibromyalgia, and it was excruciating. And I said, when did it begin? Oh, she said, in a certain date. And then I thought, oh, my goodness. Because I'd already asked her about her pregnancies, and sure enough, it was just after an abortion. And so I had to begin wondering if there is any connection, at least in some cases of fibromyalgia, between abortion and this excruciating pain. And so I looked into the biochemistry, and pain is conveyed by cholecystokinin and somatostatin and things like that pass through the placental barrier, and I believe go through and affect the mind. So the woman isn't feeling her pain, she's feeling the aborted pain of the baby. Because it doesn't have much to do with a cognitive recognition of pain, does the baby feel the pain? It has to do with tissue being torn apart. And once you tear tissue apart, these hormones are released. So these hormones are released in the baby and cross the placental barrier in the abortion and go to the mother's mind and now are registered as pain, excruciating pain. Do mothers know what the baby feels? You ask these women who have fibromyalgia, it is excruciating, unremitting pain that's hardly responding to any kind of anything. And not only that, it's becoming increasingly apparent through studies on PTSD, there are some kinds of memory called engrams that are it's not possible to erase. So now you have a memory of the aborted baby's pain, and you feel it in your body because it's registering in your head. Treatment for that, certainly not analgesics. There are going to have to be other kinds of treatment.
Well, we're grateful again to Dr. Ney for those insights. And Janet, it really is fascinating. I mean, the human body has mysteries to it that we have not yet begun to solve. And the interaction between the mother's body and that of the child apparently has even far deeper mysteries.
Right, and I think, especially when Dr. Ney talks about that in utero, there is something that passes between through the placenta or the umbilical cord or whatever, even in those earliest weeks of pregnancy between mother and child. It's fascinating.
You know, it's another way of saying once you conceive a child, your life is changed forever. No matter what you do about that pregnancy, you have already become a mother, and you have already changed. And there is that bond between the mother and a child that has many more dimensions than we even realize.
And with telling your children, if people would like more information, Dr. Ney has written a nice little booklet, and they can go to his website, which is messengers2.com, and there's that resource, Telling Your Children, which really takes you step by step how to do it. He even gives some examples of mothers who have told their children how they went about it, and then the child's reaction and the whole family and how they dealt with it. And it's a great resource, really. I highly recommend it. We recommend it to the women of the campaign to use as a tool when they have to deal with this, telling their children.
Well, people can get it right from us at Gospel of Life Ministries. We'll put everything there on the front page of the website to connect with Dr. Ney, to connect with that particular booklet, and to learn more about his research.
Hello, this is Dr. Teresa Burke, the founder of Rachel's Vineyard. One of the many ways to healing after an abortion is a Rachel's Vineyard retreat. This retreat program is increasingly used throughout the world, and it's become a ministry of Priests for Life. The weekend experience is rooted in Scripture and the sacraments, and various biblical events are relived by the participants who, for example, are approached by the priest and ask the same thing that Jesus asked the blind man before healing him. What do you want me to do for you? Participants are able to share their pain in an atmosphere of support and confidentiality, and to understand how their abortion has affected various aspects of life, and to learn from the stories of others, and to confess their sins, and to have a memorial service for their child. For more information, visit rachelsvineyard.org.
Today, I'd like to offer you a copy of my book, Shockwaves, Abortion's Widest Circle of Victims. Every abortion, aside from killing a child, wounds countless people who are connected with that child. The mom, the dad, the grandparents, the siblings, and the other relatives, the friends of the family, the abortionists and their staff, and the pro-life people also who tried to save that baby. My book, Shockwaves, drawing from the research of psychiatrist Dr. Philip Ney and from our experience in Rachel's Vineyard and Silent No More, explores the wounds experienced by these different groups and points the path to healing. Those who promote abortion try to convince us that it is a private, personal decision of a woman. Shockwaves shows that nothing could be further from the truth. Endorsed by prominent cardinals, bishops, and medical experts, Shockwaves is a book you won't want to miss. Order it today online at shockwavesthebook.com or by calling us at 321-500-1000. Again, go to shockwavesthebook.com or give us a call at 321-500-1000. Thank you. Well, first of all, I hope you enjoyed those arguments about why abortion isn't medicine. Remember what Dr. Ney and Father Pavone and I were saying, that, most surgeries, when you think about it, they help the body do something that it's supposed to do, but it's having trouble doing. So for example, maybe you fall and you hurt your knee and now you can't walk so well. So you might have to have orthopedic surgery on your knee. Well, that's to help you because now you can't walk like you used to walk. So that has to be corrected. When people have, a surgery taking out your gallbladder, well, your gallbladder got infected. So it has to come out. Why? Because it will create an infection in your body. So again, the surgery is being used to correct a problem your body is having. But as Dr. Ney points out in abortion, oh, no. The body is doing perfectly fine. It's giving life to this child. It's nurturing the child. The child's growing inside that mother's womb perfectly fine and snuggled in there, just waiting to be born. And what does abortion do? It comes in and stops the body from doing what it's been doing perfectly fine. Okay, so it's really, like Dr. Ney says, not medicine. But here's an additional argument you can use. Think about any kind of surgery you have. What happens? You go to the doctor, he diagnoses your problem, he tells you about the surgery. He tells you exactly what he's going to do to your body in the surgery ahead of time. Then he schedules the surgery, and usually you'll have to go to the hospital a few days before for what they call pre-admission testing, right? And they do blood work, they do a chest x-ray, a urine analysis, you get to talk to the anesthesiologist. All this happens days before your surgery. And then, of course, the day of the surgery, you show up at the hospital and they review again what they're going to do. You meet the anesthesiologist again, and you meet your doctor before they wheel you into the procedure room. And you get to talk to the doctor one final time. Now, what happens after the surgery? Again, you wake up in recovery and you get to talk to your doctor as soon as you're awake enough. And usually, as part of your discharge orders, you actually get discharge orders, and you'll get usually pain medicine, antibiotic prescription, and an appointment to follow up and see your doctor. Does any of that happen with abortion? No. You can tell by the testimonies of the women from Silent No More. And if you don't believe me, just go to abortiontestimony.com. Read those testimonies. You know when they see the doctor? When they're on the table, ready for the procedure about to happen. So like Dr. Nate was saying, abortion is not medicine, and the way the women are treated in the abortion clinic is not medicine either. So I hope, brothers and sisters, you're going to use those arguments really well to really change people's hearts and minds, because that's what this is about. Then on the second part of Dr. Nate's interview, we talked about the importance of telling your children. So he gave a great website, messengers2.com. Again, messengers2.com. You can go there, and he has a whole paper he's written about how to tell your children about your abortion. And he actually wrote it into a little booklet. I do have a supply of some of them here at our Priests for Life headquarters. So if you shoot me an email at orders@priestsforlife.org and just say, can Janet send us the Dr. Nate booklet? I'll know just what you mean. And I know I have a few on hand. I'd be love to send it to you. So again, orders@priestsforlife.org. Ask for the Dr. Nate booklet about telling your children. And we know how important that is. First of all, for someone who's hurting from an abortion, the first step is we want you to find healing through Rachel's Vineyard. So if you want to find out where the nearest Rachel's Vineyard retreat site is to you, go to abortionforgiveness.com. Abortionforgiveness.com. You just put in your zip code, and it shows you where the nearest Rachel's Vineyard retreat site is. And right now, I know with the pandemic, a lot of retreats got canceled. However, things are beginning to open up. And I think probably by July and definitely August, we will see more retreats begin to schedule. But even before you go on a retreat, there are counselors connected with every retreat site, and they're standing by ready to hear from you. So go to abortionforgiveness.com, put in your zip code, see where that healing is. And of course, after you've gone through your healing, then we can walk you through the steps about how to tell the other members of your family, and especially your children. So again, I want you to be in touch with us. Send us your concerns or questions about any topic, and that could be just to mail@priestsforlife.org. Father Pavone and I and our staff, we have most of our staff, because of the pandemic, still working from home, but they're still answering those emails, and we're still getting out our orders and shipping you books and things that you need. So please be in touch with us, and please be sure to tune into the other program we have on this platform. Every morning at 10 a.m., Father does the Mass. And then in the afternoon, 3 o'clock, we have Divine Mercy and Chaplain and Rosary, and my program, which repeats in the evening. Thank you, and God bless.